Hello, welcome to another post from Dr. Blake's Healing Soul. Today our athletic trainer Aphrodite will explain the treatment of plantar heel bursitis, which is normally different than plantar fasciitis.
Okay, so the first thing you want to do, we're going to discuss basically just using modalities here. You want to make sure that you're providing heat to that area to alleviate pain and to increase circulation to that area. So we use ultrasound. It's a deep heat, and this is what the machine typically looks like. This is a combination unit. So for ultrasound, you have the sound head here, and you would have to use some sort of gel. So you put the gel directly to that area, and then you're going to put the sound head right there. Turn the machine on. You have to set specific parameters, and you're just going to go in circular motions. Typically it goes about 5 minutes, and you just want to make sure you're always moving the sound head to prevent burn. So that's one way of treating bursitis using modalities. Another thing you can do is use what we call interferential current, or some type of electrical stimulation. So for the interferential current, you need 2 channels, and then you have 2 separations per channel. And then you have to use electrode pads here. So you would plug in, you have 1 channel here, and a 2nd channel here, and you always want to make sure that you cross the channels.
And this is being used for
The
what
interferential
purpose?
current is primarily to reduce pain, inflammation, and muscle spasm.
Okay.
Because it's such a small area, you could probably just use 1 channel, and then the setting would be called pre-mod. But for the interferential, you want to make sure that here's the 1st channel, that it's diagonally crossed, and then you take the 2nd channel and diagonally cross the opposite way. So basically what the current does is it goes across in a diagonal pattern, so it targets the area in the center. So, and then typically the interferential goes on for about 15 minutes, and it'll feel like a little tingling sensation. And again, it takes care of pain, swelling, and muscle spasms.
And then the role of deep tissue work?
Deep tissue work, obviously you can't really isolate that specific area, so you would kind of have to work around it. So you could do all the way up in the calves just to make sure those are nice and loose. You can do inside the actual plantar fascia just to kind of loosen up the surrounding areas. If you're inflamed in the bursa, you don't want to really target that area too much because you can actually cause more aggravation to it. So, but you can work around it. And for the soft tissue work, you just want to make sure you're using some type of lotion, and you want to really get in there to make sure you're loosening up the area, breaking up scar tissue, which will alleviate the pain in the bursa area in the foot.
Great. Well, thank you very much, Aphrodite, for explaining those principles to us.